Hello everyone, for today's video, we will be talking about hernia in Shih Tzu. Dogs can get hernias, just as people can. Dogs can be born with them or they can be the result of an injury. A hernia is a tear in the wall of a muscle that allows the internal organs or fatty tissue normally found behind the muscles in the abdomen to push through. There is good news and bad news when it comes to hernias. The bad news is, depending on the type, they can be life-threatening. The good news is that they are completely treatable. There are 5 common types of hernias seen in dogs, which are umbilical, inguinal, diaphragmatic, perineal, and hiatal. Let me explain first the 5 common types of hernias in dogs, and then let's proceed to the common hernias found in Shih Tzus. Umbilical hernia is the most common type of hernia. These are congenital and most commonly seen in puppies. You will notice that her belly button has been replaced by a squishy protrusion. Depending on the size, these can either heal on their own or can be surgically fixed. Failure to repair the hernia, if large enough, can lead to serious complications. Inguinal hernias occur in the groin area where the inner fold of the rear leg attaches to the body wall. This can range in size from small to large, and if the openings is large enough, portions of the intestine, the bladder, or the uterus can become trapped within the hernia, causing a life-threatening problem. This type is considered congenital and often affects middle-aged female dogs, especially those who are pregnant. This should be surgically fixed immediately to avoid complications. Next is diaphragmatic hernia. The muscle that separates the abdominal organs from your dog's heart and lungs is called the diaphragm. A hole in the diaphragm allows internal organs to enter the chest cavity, making it difficult for your dog to breathe. These hernias can either be congenital or the result of an injury, most commonly being hit by a car. Next is perineal hernia. When the muscles of the pelvis tear, abdominal contents enter the area adjacent to the anus. Some breeds are predisposed to this type of hernia, and it commonly occurs in unneutered male dogs over the age of 5. Hiatal hernia develops when a portion of the stomach pushes into the diaphragm, where the esophagus joins the stomach. Hiatal hernias can be congenital or the result of trauma. There are a number of different types of hernia, but the 2 most often come across in Shih Tzu are umbilical and inguinal. An umbilical hernia is the most common type of hernia found in the Shih Tzu breed. A Shih Tzu with an umbilical hernia will have a bulge in the middle of the tummy. This area can be found on a dog's stomach at the location where the umbilical cord was attached. It appears as a little soft lump or swelling. They are equally common in both males and females. Although inheritance likely has an influence in some cases, the majority of umbilical hernias are believed to be caused by the umbilical cord being severed too close to the abdominal wall at birth. Most umbilical hernias are small and will get smaller as a puppy grows. In many cases, they will disappear completely by the time a puppy is several months old. Umbilical hernias rarely require surgical intervention before this age, but a larger hernia might require repair. Breeding options do vary, but generally, if a hernia is large enough to require surgery, then the dog should not be bred from. If a dog has a small hernia, then it is okay to breed on, but as any modes of inheritance are poorly understood, the breeding should not be repeated if significant numbers of puppies are born with hernias. Inguinal hernias are less common but more likely to require corrective surgery if they don't disappear as the puppy grows. They are caused by tissue or abdominal organs protruding through the inguinal ring and show up as bulges in the groin area on one side or both. They are more common in females but do occur in both. Inguinal hernias are more likely to be a hereditary condition, so dogs with them are more likely to pass them on and could possibly suffer increased risk of complications in pregnancy, so it should not be bred from. What are the causes of an umbilical hernia? There is some debate as to the exact cause of umbilical hernias, but it is thought that most are likely inherited. At least it is thought that 90% of umbilical hernias are genetic in origin. This type of hernia is more common in certain breeds including Shih Tzu and Pekingese, although they can occur in any breed. Another possible explanation as to the cause is trauma that occurs at birth, Either the mother dog tugs too hard on the umbilicus or the breeder is rough with tying off the placenta. Now, let's talk about the treatment of hernias. Small hernias are generally not a problem and the dog can live out its entire life with no complications or problems. These small hernias sometimes close by themselves as the young pet grows. In the highly unlikely event that an umbilical hernia becomes painful to the touch, swollen, or red, the dog should be examined by a veterinarian within 24 hours. Thank you for watching. Don't forget to like, subscribe, and share our video.